this video in our ASMR anatomy series. Hope that this is something that everyone's continuing to enjoy. I'll continue to kind of try and cycle through the Bible reading series, as well as kind of pick up the Spanish practice series. Please feel free to leave any commentary of what you'd like to see more of, maybe what you'd like to see less of. Ultimately, I get to decide, but it is kind of fun to allow everybody to give their input and make sure that this is something that people can use to relax, to escape from problems for a little bit, to help you sleep even. I would love it if that's something that would be able to help you sleep. But getting back to the anatomy here, we left off last time in the beginning of the thorax, and we stopped at the sternum and ribs portion. So let's see where our little guidebook takes us to next. The joints of the thoracic cage. Says the diaphragm is the chief muscle for quiet respiration, and we can see that in on page 64, so we'll get to that in a few minutes. The muscles of the thoracic wall on page 62 contribute to deep or forced inspiration. And so what it means by quiet respiration is this is the breathing that you do without thinking about it. And then forced inspiration is like you're at the doctor's office and they tell you, okay, go ahead and take a deep breath. This is a concerted effort. You're thinking about it. So difference between the two. Now, rib cage movement. Full inspiration, shown in the red, and full expiration in the blue. There's an increase in transverse and anterior-posterior dimensions, as well as the infrasternal angle. The descent of the diaphragm further increases the volume of the thoracic cavity. Now, if that didn't make any sense to anybody, basically what that's saying is that whenever the diaphragm descends, it's opening up and creating more volume within the thoracic cavity for air to fill the lungs. So there's positive pressure and negative pressure, and when the diaphragm descends, it creates negative pressure, which causes air to flow in naturally. On inspiration, here's your infrasternal angle, and then your transverse thoracic dimension on the outside, and then your AP dimensions. So inspiration, these portions are expanding. And then on expiration, there's a contraction in the blue, for the blue portions. So those areas are becoming smaller, forcing air out. And then this just kind of shows a neat little overlay of those two different portions. So at full inspiration, and then at expiration, the compression in comparison, the diaphragm's coming up versus the diaphragm going down on breathing in. Alright, and then we've got the axes of rib movement, a superior view. So your axis of movement is going to be right here versus the neck of the rib. And then you've got the body of the vertebrae right here. And then the axis of movement. So this is comparing a lower rib versus an upper rib. It's these aren't the same. These aren't the same vertebrae. These are different vertebrae. And this causes an increase in anterior-posterior dimensions, and then an increase in the transverse dimension. So this is going, the upper ribs are going more forward than out, and the lower ribs are going more out than forward. Sternocostal joints, figure 7.7. An anterior view with the right half of the sternum sectioned frontally. True joints are generally found only at ribs 2 to 5. Ribs 1, 6, and 7 attached to the sternum by the syncrodrosis. There we go. Sorry about that. Clavicular notch, your first rib. And then here's your second rib. So this is going to be a true joint. Your third rib, fourth rib, fifth rib, this is going to be considered a true joint. So 2, 3, 4, 5, your true ribs. And then 1, 6, and 7 attached to the sternum by syncrodosis. xiphoid process itself. And then, of course, we've just got some costal cartilage. Now, some costovertebral joints. Two synovial joints make up the costovertebral articulation of each rib. The costal tubercle of each rib articulates with the costal facet of its accompanying vertebrae. Here in figure A. The head of most ribs articulates with the vertebrae of its own number and the vertebrae immediately superior. Ribs 1, 11, and 12 typically articulate only with their own vertebrae, so those are kind of the exceptions. The first rib sits on the very bottom of the rib cage, and then if you remember, 11 and 12 are floating ribs, so that would make sense as to why they don't have a typical juncture. Now, let's look more at what it's talking about here. So it says two synovial joints, the costal tubercle of each rib articulates. So here's the costal tubercle of the rib, and that is going to articulate with the costal facet of the vertebrae. And then we've got some ligaments holding that together, the costotransverse ligaments. And then there's a radiate ligament here. And then looks like another ligament here to help hold the structure together, a lateral costotransverse ligament. Again, a lot of this nomenclature is pretty straightforward once you get it down. Lateral, it's on the side, costotransverse ligament. So, yeah. Here's the facet for the rib tubercle, and that's the juncture right there. The tubercle and then the facet. There's the articular surface of the facet right in here. And then all this together makes up the costotransverse joint. And what they're showing us here, it's the neck of the 8th rib. That's what we're working with. And then the joint of that joint head of the rib. And again, T8, because this is the 8th rib. And then there's an intervertebral disc. And if you remember from previous videos, the annulus pulposus here in the middle. Now, these are costovertebral joints. A left lateral view with the joint head of the 7th rib opened to allow us kind of a look in. So T5, T6, T7, so this is where it's opened up. And it allows us to see the intra-articular ligament. We can see the crest of the rib head. And then let's see what else is in here. The articular facets on the head of the 7th rib. So those junctures. And then holding these transverse portions together, the superior costotransverse ligament. Costal tubercle of the 8th rib. Here's the radiate ligament, which we saw. Where did we see that? Here. Now we see it from a lateral view over here. And then this is just to orient us. So T5, T6, T7, T8. We already talked about the intra-articular ligaments. And then the costal facets, which we're used to from our previous coverage of all things ribs and spine. Transverse process up here too. And now we'll be talking about the thoracic wall muscles, facts. These seem to be enjoyed before the muscle facts. That was one of the more popular videos that I've made so far. So thank you for your continued support on videos like this. Please continue to provide commentary as you listen along. The muscles of the thoracic wall are primarily responsible for chest respiration, although other muscles aid in deep inspiration. The pectoralis major and serratus anterior are discussed with the shoulder on pages 314 and 315, and the serratus posterior is discussed with the back. So we already covered that earlier when we did the muscles of the back. Now, muscles of the thoracic wall. There will be some overlap for the neck muscles that we did because some of those neck muscles aid in the lifting of the rib cage, which assists in inspiration and expiration. So you've got your scalene muscles on your neck. So you've got, let's see, yeah, we can go through all of them. The scalene muscles, the intercostal muscles, and the transversus thoracis, and we've not yet discussed those, so that'll be a new thing for us to get into. Alright, let's go ahead and start out with these scalene muscles. Anterior scalene muscle, number 1. The origin is C3 through C6. Transverse processes, anterior tubercles. So it starts up here. 3, 4, 5, 6. insertion is pulled to the origin. So this is going to be lifting the first rib. Innervation is the anterior rami of the C4 through C6 spinal nerves, which makes sense because it's running right along C3 through C6. And this action for this and all the scalene muscles, with the ribs mobile, it raises the upper ribs for inspiration. So it's going to pull the diaphragm. Or excuse me, it's not going to pull the diaphragm. Forgive me. It's not going to pull the diaphragm. It's going to pull the ribs up. And then with ribs fixed, it bends the cervical spine to the same side unilaterally, or it flexes the neck bilaterally. And we'll go ahead and talk about the other two muscles. They have the same function. The middle scalene muscle, number 2, C3 through C7. And this actually is the posterior tubercles versus the anterior tubercles as far as an origin. The insertion is the first rib posterior to the groove of the subclavian artery. C3 through C8 spinal nerves, which also tracks. It's a little bit further down, so it gets some additional innervation. And then the posterior scalene, so these are the most lateral. C5 through C7 posterior tubercles, also like the middle scalenes. So these, you can see 2 and 3 kind of hook to the back a little bit more, versus the anterior scalenes, appropriately named anterior, are more on the front. And they're going to attach to the outer surface of the second rib. So down here, whereas the anterior and the middle are on rib 1, the posterior scalenes are on rib 2. Alright, now we're going to get into the intercostal muscles. Anterior view. We've got the external intercostal muscles. You can see them right here. And origin is the lower margin of the rib to the upper margin of the next lower rib. And it courses obliquely forward and downward from the costotubercle to the chondro-osseous junction. So kind of sort of weaving up and down. And it's going to be innervation of the 1st to the 11th intercostal nerve. So basically whatever level of a rib it's at, it's going to receive innervation from that level's intercostal nerves. And these are going to serve to raise the ribs for inspiration and support the intercostal spaces while stabilizing the chest wall. Internal intercostal muscles. So we got external, and now we're coming more interior. We're going further into the rib cage. And actually the innermost intercostal muscles, both of them 5 and 6. So innermost couldn't be more appropriately named. And these are going to be the lower margin of the rib to the upper margin of the next lower rib, coursing obliquely forward and upward from a costal angle to the sternum. Same type of innervation, but these, in comparison to the external, are going to actually lower the ribs for expiration, supports intercostal spaces, and stabilizes the chest walls. So external is going to raise the ribs, and then the internal and the innermost are going to work against that action for expiration to lower the ribs and push that air out. Subcostal muscles. Let's see, that's going to be kind of separate from what we've talked about already. The lower margin of the lower ribs to the inner surface of ribs 2 to 3 ribs below. And then it's got the adjacent intercostal nerves, and it assists in the lowering of the ribs. And now we've got the transversus thoracis, posterior view. So we are inside the rib cage here, looking at the back of the rib cage. So this is the back of the sternum, and the ribs are kind of wrapping around our perspective here. A 3D view that might be a little bit difficult to see because, I'm recording here, whereas I can see some of the depth on the picture. So the origin of these is the sternum and the xiphoid process, inner surface going into the ribs. And it's going to insert into the 2nd through the 6th ribs, the costal cartilage, inner surface. And then the innervation is the 2nd to 6th intercostal nerves, so running right along with it. And it very weakly lowers the ribs on expiration. So just kind of an assisting muscle. Here's another look at the muscles of the thoracic wall. So this is an anterior view, and it says the external intercostal muscles are replaced anteriorly by the external intercostal posteriorly by the internal intercostal membrane, removed in figure 7.11. So it's taken off down here. Alright, so there'll be some features that we've already talked about before, and just for the sake of orienting ourselves, atlas is C1, axis C2. We've got the anterior longitudinal ligament running along here, along the front of the spine, on the body of the spine. Got a posterior scalene muscle, the middle scalene muscle. Posterior's here, middle, anterior. So remember, 1, 2, 3. 1, 2, 3. Here's the first rib, which, as you remember, is the insertion for the posterior, or excuse me, the anterior and the middle scalene. And then the second rib is the insertion for the posterior scalene. We've got the manubrium, the body, and the xiphoid process of the sternum. The external intercostal muscles, which we just talked about. The external intercostal membrane on the outside of that. The costal cartilage running on the ribs here. Another look at the external intercostal muscles, but now here we get to see the internal intercostal muscles, and then the radiate sternocostal ligaments right along here. And then that continuation of the anterior longitudinal ligament. And then the transversus thoracis. So you can see we're looking into the rib cage here, just like we were here. It's an anterior view with the thoracic cage opened to expose the posterior surface of the anterior wall. So we're on the back, we're inside the chest cavity right here, looking in at the inside of the chest cavity. So we've got the manubrium, we've got the internal intercostal muscles on the outside, because remember, we're looking at the inside of the rib cage. So the external intercostal muscles will be on the outside here. The transversus thoracis, we can see them more accurately represented. We've got these little strings here just for simplicity's sake, but the muscles are in reality are actually thicker, and they are helping to lower the ribs for expiration, as you might remember. And then the xiphoid process, costal cartilage, kind of like what we've already covered, the scalene muscles, and external and intercostal muscles. But now we can see here differently the innermost intercostal muscles, what we couldn't see before, and then those subcostal muscles as well. We've got the diaphragm here. Alright, so we've kind of teased it a little bit to this point, but now we get to get into the diaphragm in earnest. So figure 7.12, diaphragm. The diaphragm, which separates the thorax from the abdomen, has 2 asymmetric domes and 3 apertures for the aorta, vena cava, and esophagus. And you can see those in figure 7.13, so over here, which we'll get to in just a second. But first, let's take the time to orient ourselves, make sure we're in the right place, or we're looking at the right thing, we understand where we're at. So we've got an anterior view here, looking at the front of the body. We've got a posterior view, looking at the back of the body. The sternum, there's the central tendon, which we haven't talked about yet, which assists with the diaphragm. And then the diaphragm sternal portion attaching to the posterior of the sternum. The diaphragm, the right dome. The diaphragm, the costal portion. Here's the 10th rib for the sake of orienting ourselves. So 11 and 12, the floating ribs have been transected out of the way just so they don't interfere with what we're looking at. Here's the left dome of the diaphragm. The xiphoid process, of course, and then a transverse process of a vertebrae, just so we can kind of get a full composite picture of what we're looking at. Here's the lumbar part of the diaphragm. So we've got multiple parts here already that we've looked at: the right dome, the left dome, the costal portion, and the lumbar portion. And then the right crus, which is another word for cross. The aortic hiatus, because that aorta is a huge piece of vasculature that you need to leave room for. And then the left crus over here. Posterior view shows us the shoulder, the clavicle, the scapula, the caval opening, the diaphragm, the costal portion of the diaphragm, the lumbar portion stupid little way to remember it, but we're looking at a transected portion. So we're looking into the interior view of the body with a lot of the front of the body transected away. We're looking in. So let's orient ourselves here. We've got this cable opening, which we saw here. Here it is. So we already know that this is in the thoracic region. So we're looking from the thoracic region down. We've got the esophageal hiatus. We've got the central tendon, the left dome and the right dome, the right crus and the left crus, the aortic hiatus. We've got a lateral arcuate ligament here. The quadratus lumborum, major muscle of the back. The psoas major, another major muscle of the back. The transversus abdominis here. But the biggest thing I think that they're trying to show here, and we'll talk, they're trying to talk about show some of the different aspects of the diaphragm, but these hiatuses to show how important it is to allow some of these structures, mainly the aorta and the esophagus and the vena cava to go through. That's the big deal. But so it says for the costal portion of the diaphragm. Let's go ahead and find that. We've got that here. So the costal portion, the origin is the 7th to 12th ribs, inner surface, lower margin of the costal arch, and the insertion is up into the central tendon. The innervation is the phrenic nerve, which is part of the cervical plexus, branching off of C3 through C5. And this action, for all parts, it's the principal muscle of respiration, diaphragmatic and thoracic breathing. It aids in compressing abdominal viscera as well. So you can have a real bad piece of news called a hiatal hernia, where a portion of your organs that are here below the diaphragm can pop up through one of these hiatuses that are designed for the esophagus or the vena cava or the aorta. It can pop up through there, and it requires surgical intervention to basically just say, hey, go back down there. You're not supposed to come up here. Continuing on, the lumbar portion. So the lumbar portion, we can see that here, and we saw it here. The origin is the medial part of L1 through L3 vertebral bodies, the intervertebral discs, and the anterior longitudinal ligament as the right and left crura. So a lot of involvement here because it's doing a lot in this portion to assist in the breathing. Insertion, central tendon, innervation, the phrenic nerve. And then there's a medial part and a lateral part. The lateral and medial arcuate ligaments. And then the sternal part, the xiphoid process, posterior surface. So it's going to attach right here. So this little tiny point does serve a purpose. Alright, now we've got the diaphragm in C2. Got the sternum here, the sternal portion of the diaphragm, the central tendon, which is the attachment, the insertion point for all of the diaphragm, the caval opening, intercostal muscles. You can see here the esophageal hiatus. We've got T8, just orienting, so we're at the T8 level. We're mid-thoracic, or lower thoracic, I guess you should say. A rib here, the intrinsic back muscles, the parietal pleura of the lungs. So the border of the lungs is going to meet this diaphragm here. Or the pleura, I should say, not the lung itself, but the pleura. Which makes sense given its relationship with breathing. Here's the costal portion and the aortic hiatus, this nice gap right here for that thick blood vessel to go through. This is a superior view. Now we've got an inferior view, so this was top down, now we're looking bottom up. The caval opening again, the esophageal hiatus. You've got your aortic hiatus, so those three big structures. The central tendon, the lower portion of the sternum, the sternocostal triangle, the sternal portion of the diaphragm, the rectus abdominis, so this is part of your abs right here. The costal portion of the diaphragm over here. We've got the left crus and the right crus, which is processus abdominis, the quadratus lumborum here, the psoas major, the intrinsic back muscles, the medial arcuate ligament, and the lateral arcuate ligament, your latissimus dorsi, your lats for those of you who love doing pull-ups, and then the lumbocostal triangle, Bogdalik's triangle. So if you find a cool triangle within the body, you too can have a triangle named after yourself in anatomy. And here is a left lateral view of these apertures. So here it's just been showing us the spaces that are designed for these features. But now we get to see how they run through in relationship to the apertures themselves. So at about the T8 level, which is where they've decided to transect it, right where these structures are going through, you've got the esophagus, which looks like it butts up against the T10 vertebral body. T12, you can see the aorta prominently here, and then T8, you've got the inferior vena cava here, which it's showing coming through at about the T8 level. So that is the diaphragm, and I think that's a good place to stop. And next time we'll get into the neurovasculature of the diaphragm. I know that I enjoyed going through the neurovasculature of the back previously, and now we get to go through it for the diaphragm and see how this neurovasculature runs in relationship to the heart, to the diaphragm, and kind of lies in the background to a lot of the internal structures, like the lungs and our intestines through here, the liver and the stomach and the intestines through this portion here. But to be able to see that, you'll have to wait till next time. Sorry. If you've watched the video to this point, I appreciate you sticking with me. And as always, if you liked this video, please leave me a like. Please subscribe so that you can see more content like this. It helps people like myself continue to make content that's interesting to you and that you enjoy. I hope you did enjoy it. I hope you have a great rest of your day. And I'll see you next time.